Okay. So last class we were discussing about the Vaisheshika Kalpana and Vaisheshika Kalpana syllabus. And same time, we heard about Prakshepakas. And separate chart has been given in the material about Prakshepakas. So Prakshepakas are preservatives, one angle, and another way it will enhance the action of the drug, it will enhance the potency of the drug. Okay. So in olden days, we are using a Prakshepakas. So nowadays, we are using a modern chemicals as a preservatives. So in our syllabus, there is some questions about modern preservatives used in eye drops, used in external applications, ointments, especially in kashayas and so you have noticed like that benzalkonium acid, benzolites, sodium benzoate. So are the preservatives used in medicines, okay, tropical applications and all that. So the question is, what is the percentage of these preservatives, and what are the preservatives can be used in particular applications or particular drug preparations? That may be the AAPGT questions. You can note down. In food and cosmetics, benzoic acid and benzoates. Note down. In food and cosmetics, we have a preservative. In food and cosmetics, we have a preservative, benzoic acid and benzoates. Benzoic acid and benzoates. Benzoic acid and benzoates. Yes. Benzoic acid and benzoate. What is the percentage concentration of this benzoic acid and benzoate is 0.1 to 0.2%. Only 0.1 to 0.2%. Benzoic acid and as well as benzoate 0.1 to 0.2%. So these benzoic acid and benzoates can be used as a preservative in oral preparations also. So it may be syrups, liquids. Nowadays in our asavarishta also they are using these preparations, and in kashayas also, because our classical kashayas can be used within 24 hours after preparations. If you want to use the same kashayas for a longer period, so they are adding benzoic acids and sodium benzoates as their preservative. So that's why in Kerala they won't use ready-made bottled kashayas. So every day they will freshly prepare the kashayas and they will serve to the patients. The results will be very good if you use a fresh prepared kashayas. All Panchaveda kashaya kalpanas are to be prepared freshly and to be served up to 24 hours. Okay, the expiry is 24 hours. Maximum expiry time is 24 hours. Okay, so if you use fresh kashayas, then the potency will be very. So it may be the preservative. Definitely, we cannot expect so much of potency from these prepared kashayas. Aswarishta, no issues. Self-generated alcohol will be there and the potency will be higher if you use it older also. Okay, especially in kashayas, if you use fresh, will be good. So for that reason, you can purchase kashaya Vata churnas. So ask the patient to prepare kashaya according to kashaya method. So let them complete it within 24 hours. Okay, for treating any acute diseases or in a chronic diseases, it will be helpful. Right. Next, salicylic acid and salicylates. Salicylic acid and salicylates. Oral preparation. Salicylic acid and salicylates. Oral preparation 0.1 to 0.2. 0.1 to 0.2. Salicylic acid and salicylates. Oral preparation. So especially in case of ocular stomatitis, mouth ulcers. So what in those applications we are using salicylic acid and salicylates. So for example, we have Himalayas Ayora gel, so Ayora pain gel. So in that they have a salicylic acid and salicylates as the one of the preservative. Okay. So especially in mouth ulcers, many a times it is a pitta pradhana vyadhi. So we thought it's because of pitta and we will give according to our treatment. So pitta dravyas starting from Vishada, Chandana, Paripata Dekada, so even Gudichi. all these drug of choice. Or else directly Pitta Shamana will go with Kamadaga, Kamadagutmuktika, Pravala Panchamratal, all these medications. But still, so I have a patient who has repeated ocular stomatitis, repeated mouth ulcers every 7th day or every 10th day since 10 years. So we visited our clinic. So then we thought of any liver issues and other. We have tested for cancer also when patient come to the clinics. Then nothing was significant. So there is no cancer, nothing was significant. Then we have checked with vitamin B levels. So ocular stomatitis is a deficiency of vitamin B2. Patient has a severe acidity. So we need to see treat acidity. It's 100% true. We'll give medications or Kamadugarasa with Moktika, Pravala Panchamrata. All these medications will work on acid levels and digestion levels. So it will mitigate pitta in the level of amasya and tapasya. So when come to the Rona and where exactly the ulcers, so there we want external applications. Gruta applications are best. So that will yield Rona Shodhana and Ropana action will be expected. Very good. So Jatyadi Gruta can be used internally and externally also we can apply. Or else Amalaki Gruta we can apply. Triphala Gruta we can use. Shatadauta Gruta we can use. Internal application. So Pitta Shamana action also Rona Ropana action also we can expect. And one common drug we have used apart from our classical medicine is vitamin B2, riboflavin. Okay, after using these medicines, Ayurveda medicines, the intensity becomes reduced 20 days, 30 days, like that. But still, patient have some mouth ulcers again and again. Then I have a doubt, and then I prescribe riboflavin, continuous riboflavin intake for minimum 3 months. So riboflavin alone single drug will be available. It's vitamin B2. 10 mg of riboflavin is available in the market, costing about only 30% or 40%. So a very old drug nobody will use in present day practice. Everybody will prescribe vitamin B complex, but need of the hour is only vitamin B2, riboflavin. So after consumption of the drug along with Pitta Shamana Aushadhis of Ayurveda with riboflavin, patient was alright. He was suffered with 10 years. He can unable to consume, unable to chew even tikta, katurasas, he cannot consume. So food and able to remember only milk diet. So alu anna, masur anna, majjiga anna, all throughout the clock because of its ulcer. And one more easily thing we can advise is if they have a coconut oil in the home, let them gargle coconut oil, or else gruta directly they can gargle. Okay, or else only coconut they can chew. So that will also heal the ulcer. So easy methods. Or else they can apply butter also over the area. So these are all some of the home remedies we can advise to the patients at the time of ocular stomatitis or oral ulcers anywhere. So ulcer may be from the oral to anal. The drug of choice will be same. Any Rona will be pitta. Okay. So for Rona Hara action, fastest medicine will be Triphala Guggulu and Gandhakarasayana. So any from oral to anal ulcers, you can use this drug. Just like modern aceclofenac, sodium paracetamol, along with some antibiotic. So like that, we can use our Triphala Guggulu and Gandhakarasayana. Even one of our Guruji, Dr. Sharma sir in Udupi, he will use Triphala Guggulu Gandhakarasayana post surgery without using any antibiotics. You won't use any antibiotics post surgery, any painkiller post surgery. Only Triphala Guggulu along with Gandhakarasayana. Okay, so much of effective is our drugs. So definitely it will work. Okay. So whenever the Rona patients come to your clinic, just remember Triphala Guggulu, Gandhakarasayana. Then you can think about after some medicines. Right. Next, in case of cosmetic preparations, cosmetic preparations, phenyl mercuric acetate and nitrate, 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 phenyl mercuric acetate and nitrate. In case of cosmetic preparations, phenyl mercuric acetate and nitrate. So even in eye drops also we can use the same thing, 0.01%, 0.01%, 0.01% phenyl mercuric acetate or nitrate can be used in case of cosmetic preparations. If you make a very good cosmetics in Ayurveda, definitely we have a very good market everywhere. So especially peoples will be worried about their beauty, external beauty. So aesthetics is very important. How they look is very important. The glow, skin glowers, we have a huge market all over the world. So even medicines will use for whitening of the skin, melasma treatment. So need of the. So in that regard, you can work it out. So one home remedy I can remember after all the drugs we have used in the available market in case of acne and acne marks. We used all almost medicines, all Shodhana methods, and still patient will have this. Then we have planned for giving only Aridra and as well as Chandana. 1/4 part of Aridra and 3/4 part of Chandana. So Chandana will make the part dark. If you use it with Aridra, then it becomes white. So Chandana has having an action of Pitta Shamana, Rana Shodhana, and as well as uh, Tvak Prasadar. So that is the need of the hour. So making the skin healthy is important. And Aridra will also having the same along with antimicrobial action. Aridra will have an antimicrobial action. It may be virus or bacteria, any microbe present in the skin, it will going to die by using Aridra. Aridra Chandana is the best drug of choice after some initial treatment for acne. So skin will become healthy and glow will come automatically. And caution is if you want to use chandana, use original chandana. So don't use chandana powder available in the market. Don't use chandana tail available in the market. So purchase chandana from the market per gram. It may costing about from 10 rupees to 50 rupees per gram of chandana, and rub it in a stone along with aridra. Then you can use. Don't use market available samples. Again, you will make problem aggravated. Okay, so use only the fresh aridra and fresh chandana. So this definitely will cure you the acne marks and as well as melasma. So time duration will depends person to person, some days to some months, depends. You can utilize this medicine. Next, so lotions and tropical applications. In case of lotions and tropical applications, you can use phenol 0.5%, phenol, 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 phenol 0.5%, lotions and tropical applications, phenol 0.5%, Cresol, CRE as well, Cresol 0.03%, Cresol 0.03%, okay, and chlorocresol 0.1%, chlorocresol 0.1%. So these are all the preservatives, modern preservatives used in tropical applications. Okay, we'll go with some important preparations given as syllabus. First, we'll start with the churnas. First one is Dadimastika Churna. Reference is Sharangadara Samhita. Dadimastika Churna. Reference is Sharangadara Samhita. Dadimashtaka Churna, reference Sharangadar Samhita. So key ingredients: Dadima, Rikatu, Kanda Sharkara, Triganda, etc. So this Dadimastaka Churana can be used in case of Haruchi. Right? Okay, it's a Ruchi Karaka. And Kantya. So those who have any problem with Kanta, okay, so repeated throat infections and the low voice, so harshness in the voice. So it may be chronic. In that case, we can use Dadimastaka Churana. And it is a Grahi Kasahara Jwarahara, especially Pitta Jwara. Grahi Kasahara Jwarahara. So if you remember Dadimastaka means, you should remember Dadimastaka Churana can be indicated in case of Pitta Jwaras, Haruchi, and as well as Kantya. So Kantya we can choose two drugs. One is Yasti Madhu and one more is Dadima. Both the drugs you can choose. And those who are not willing for Snehapana with our classical Grutas, so they are not willing to drink our Grutas, you can advise Dadima Adi Gruta. It's a very good drug of choice. Dadima Adi Gruta. And palatable. It's palatable. So we can easily drink. Okay, Dadima you can think in case of Chitragadi Vati, the Bhavana Dravya and Chitragadi Vati is Dadima Swarasa. Okay, if Dadima comes, you should remember these things. Okay. Bruhad Dadimastaka Churana, you remember. So Adhikara is Atisara. Bruhad Dadimastaka. Adhikara is Atisara. Same indications along with Atisara and Jura. Mandura Vataka, next drug. Mandura Vataka. I will take only some important drugs of clinical importance. Okay. There are a lot of things in syllabus. We'll go with only clinical importance. Mandura Vataka. Adhikara is Kamala. In key ingredients: Triphala, Panchakola, Trikatu, Devadaru. Triphala, Panchakola, Trikatu, Devadaru, Pippali, Gajapippali, Kapikachu, Shankapushpi. Anupana Haritaki Kashaya. Sorry, Takra. Haritaki Kashaya is Takra. Anupana is Takra. Indications: Kamala, Pandottara Kamala, Urastamba, Ajirana, Pliha. Pandottara Kamala, Urastamba, Ajirana, Pliha. Only one point you should remember. So key ingredients are Triphala, Panchakola, Trikatu, Daru, Devadaru, and Swarnamakshika. And same time, Mandura used twice that of the other ingredients. Mandura Vataka means Mandura is double quantity that of other ingredient. Sarva Dvigune Mandura. In the sloka, it's very clearly given that Sarva Dvigune Mandura. Twice that of the other key ingredients. So it can be used in case of anemia, so iron deficiency anemia. It has a sodium oxycontin as well as Mandora. So along with Triphala and Panchakola, very good absorption will be there in the body, and it can be used to detox liver also. The same drug, it will enhance hemoglobin and also detox liver, and also it will increase appetite. Okay, single drug, we have all the properties. So in our clinical practice also, we have used Mandora Devataka extensively. So daily one tablet of Mandora Devataka for a month, definitely it will increase 0.15 to 1% of hemoglobin, without any doubt. And vitamin C, if they need, you can advise vitamin C. So amla sarasa or else lemon frequently let them take. Otherwise, no issue. Only plain Mandora Devataka is enough. Next, Agastya Ritaki Avalekya. Agastya Ritaki. Kasa Adhikara. The question I asked, oh, the total quantity of Haritaki present in Agastya Ritaki Avalekya in the preparation. 100 Haritaki. 100. 100 Haritaki. Then Dashimola is there. Pippali. Gaja Pippali. Kapikachu. Shankapashpi. 100 Haritaki, you can find it out. So make underline for 100 Haritaki present in Agastya Haritaki. Dashimola is there. Pippali, Gaja Pippali, Kapikachu, and Shankapashpi. So indications: Kshaya, Kasa, Jwara, Valipalitya, Valavarnakara, Valipalitya. So here we have an indication of Agastya Ritaki in case of hair fall also. Early graying of hair and as well as hair fall. So Agastya Ritaki is indicated. And if you just look at the drugs present in Agastya Ritaki, so all the drugs are Vatahara and as well as Kafahara. Mainly, if you want a Kafara action, so you can advise Agastya Ritaki like that. So usually we will advise Agastya Ritaki in the month of December and January, those who are suffering from asthma, because this is a Kapha Sanchaya Kala. If you use Agastya Ritaki during Kapha Sanchaya Kala, so Kapha Vilayana will happen. So Kapha Shodhana will happen. So patient will not suffer with asthma in upcoming Varsha Rutu. Okay. So Sanchaya Prakopa Pashana will happen in Shishira Vasanta, Grishma, Varsha, Sharadevanta. So in case of when we have to advise for Vamana, Vasanta Rutu. During Vasanta, Kapha Prakopa will not take place, so patient will be all right. Even in Varsha, again and again, patient will get severe attacks of asthma that can be prevented if you advise Rasayana in this particular Rutu, especially in this Kapha Sanchaya Kala. Okay, December, November, December, and January, it's Kapha Sanchaya Kala only. So in this month, we can advise Agastya Ritaki. So at the same time, after Shodhana, we can advise Agastya Ritaki for Valipalitya. So Valipalitya is because of Kapha Avarana. So Medadati Kapha Avarana case, we can use Agastya Ritaki. So it's because of Pitta predominance, then we should go with Narsimha Rasayana. Valipalitya is because of Pitta, then we should go with Narsimha Rasayana. Valipalitya is because of Kapha Avarana or Kapha Adhikya, then we should go with Agastya Ritaki. Is a Rasayana. What is the Rasayana can be advised in case of Valipalitya? So we have a choice according to the doshas. So Kapha dominant, Agastya Ritaki. Pitta dominant, Narsimha Rasayana. Narsimha can be advised in both Vata Pitta dominant. So Agastya Ritaki in case of Kapha Vata dominant. Especially Kapha, and we have a Dashmula in it to control action. So Aritaki and Dashmula. So it has a very controlled action. It will not completely drain out the kapha, or it will not after drain out the kapha, again vata will go into increase. So it has both the drugs, Haritaki, and along with other drugs, it has a Dashmula also. Dashmula is Shrestha Vatahara, Shodhara Dravya. So we can expect both the actions in a single drug. All our medicines are working in dual action. Same medicines is having a dual action. So I've given the example reserpine and anti-reserpine. Even in today's webinar, the madam has given some insights in Abhayarishta. Abhayarishta we are using in case of harshas, okay, in case of constipation. So in case of gulma, so we are using same thing to induce proper defecation. At the same time, Abhayarishta will also act as a grahi in same patients. In case of harshas bleeding piles, it will act as a grahi. So Anulomana and Grahi action will be present in a single compound formulation. Cannot expect in a single herbal drug, but it is a single compound formulation. You can expect both actions. As a single herb, as a single whole drug, single herb, it's there also we can expect both actions. Especially in case of Sarpagandha, I have given the example. It has a reserpine and anti-reserpine. Same drug can be used in case of hypotension and as well as hypertension. Okay. Next, Kasisadi Gruta. Adhikara is Kushta, Dadru, Pama, Spotaka. Kushta, Dadru, Pama, and Spotaka. Ingredients: Kasisa, Haridra, Manashila, Haratala. So Kasadi Gruta can be used in case of Shuka Dosha, Nadi Urana, Shuka Dosha, Nadi Urana, especially Luta Visha. We just mark it out. Luta Visha. Mark Luta Visha. Rana Ropana and Suvarnikarana. Savarnikarana. And it will keep the Rana in proper. Okay. So it means that it won't allow to infect Rana. So we are using an antiseptic preparations, especially Dettol or betadine. So these are all antiseptics. Okay. So why we are using all those things? If any microbial things is there, we need to cleanse them. This will not going to heal the wound. Body will automatically heal the wound. Okay. This will only to prevent the sepsis. Antiseptic. Okay. So in the same way, we are using Panchavalkala, Triphala, Dashmula Kashaya, Prakshalana over the Rona. We have the same action, but Kasadi Gruta will have all these actions. Savarnikarana, it will prevent the infection and also it will repair the wound. Both the action we can expect in a single Gruta, Kasadi Gruta. Next, Pinda Taila. Vatarakta Adhikara, Sharangadara. Write the ingredients. Manjishta, Sariva, Yashtimadu, Sikata. Each one pala. Sikata means bee wax here. The word meaning of Sikata here is beeswax. Okay. Honeybee wax रहता है इधर. ಅದು ಪಿಂಡ ತೈಲದಲ್ಲಿ. ಸೊ ನೀವು ಪಿಂಡ ತೈಲ ನೋಡಿದ ತಕ್ಷಣ ಓನ್ಲಿ ಆಯಿಲ್ ಕನ್ಸಿಸ್ಟೆನ್ಸಿ ಇತ್ತಂದ್ರೆ ಡೋಂಟ್ ಪರ್ಚೇಸ್ ಪಿಂಡ ತೈಲ ಫ್ರಮ್ ದಟ್ ಕಂಪನಿ. ಸೊ ಅಲ್ಲಿ ಅಲ್ಲಾಡ್ಸಿದ್ರೆ ಬಿ ವ್ಯಾಕ್ಸ್ ಕಾಣ್ಬೇಕು. ಯು ಕ್ಯಾನ್ ಸಿ ದ ಸಿಕ್ಕತ ಇನ್ ಪಿಂಡ ತೈಲ. ಸೊ ಇಟ್ ವಿಲ್ ವರ್ಕ್ ಇನ್ ವಾತ ರಕ್ತ, ಎಸ್ಪೆಷಲಿ ಬರ್ನಿಂಗ್ ಫುಡ್. Okay, so vata along with rakta. So rakta vikruti because of vata and vata vikruti because of rakta. So both cases we can utilize. Especially, we got a very good results in case of burning food. Directly we can apply. So redness and burning. So definitely we'll get good results in case of burning with red rust. Okay. ನ್ಯೂರೋಪತಿನಲ್ಲಿ ವಿಲ್ ಮಿಕ್ಸ್ ಬೋತ್ ತೈಲ ಎಸ್ಪೆಷಲಿ ಯಾವುದು ಪಿಂಡ ತೈಲ ಅಂಡ್ ಆಸ್ ವೆಲ್ as ನಾರಾಯಣ ತೈಲ. ನಾರಾಯಣ ಕಂಟೈನ್ಸ್ ಶತಾವರಿ ಅಂಡ್ ಪಿಂಡ ಕಂಟೈನ್ಸ್ ಬಿವ್ಯಾಕ್ಸ್. ವಾತ ಅಂಡ್ ಪಿತ್ತ ಡಾಮಿನೆಂಟ್ ಇರುತ್ತೆ ನ್ಯೂರೋಪತಿ ಕಂಡೀಷನ್ಸ್ ಅಲ್ಲಿ. ಸೊ ವಾತ ಪಿತ್ತ ಡಾಮಿನೆಂಟ್ ಯು ಕ್ಯಾನ್ ಯೂಸ್ ಶತಾವರಿ ಅಲಾಂಗ್ ವಿತ್ ಪಿಂಡ ತೈಲ. Only pitta dominant, only you can use pinda taila. Vata dominant, only you can go with narayana taila. Narayana taila is not an irritant. So ನಮ್ಗೆ ಏನಂದ್ರೆ ನಾರಾಯಣ ಅಂದ ತಕ್ಷಣ ಇಟ್ಸ್ ಪೈನ್ ಕಿಲ್ಲರ್ ಆ ಲೆವೆಲ್ ಬರುತ್ತೆ. ಇಟ್ಸ್ ರಿಜುನೇಟರ್. Contains shatavari is a key ingredient. Shatavari swarasa is there in the preparation of narayana taila. Shatavari swarasa. Narayani is a synonym of shatavari. Okay. Ichha Vedi rasa. Adhikara is Shula and Udara. Shula and Udara Adhikara. Swarnakshiri, Dantabija, Swarnakshira. Finally, it is Godukta Bhavana. Yellow irritants. Drugs irritant. Along with Tankana is there, Darada is there. Swarnakshiri, Dantibija, processed with Swarnakshira. Swarnakshiri, equal part. Godukta. Finally, Bhavana done with Godukta. So dose is 1 to 3 gunja. So 3 gunja is the dose. Anupana is Shitodaka. Anupana is Shitodaka. If you use Ushnodaka for Ichabhaja rasa, then it will stop its action. If you want to stop the action of Ichabhedi, so just advise the patient to drink hot water. Admana, Ajirada, in that condition we can use Ichabhedi rasa. It's a purgative, so we cannot expect a laxative action here. It's a strong purgative. Ichabhedi is a strong purgative. You want to, if the doshas are in the kosta, if you want to forcibly bring down the doshas at its maximum level, you can use Ichabhedi rasa. If Sroto Shodhana, we need a proper Sroto Shodhana, Sroto Vilayana, Vata Shamana, Snigdha Virechana. At that case, we can go with Gandharvastadi Taila. Castor oil, we can go with castor. Snigdha Virechana, Sroto Shodhana action. Here already doshas in the kosta, you need to take it out completely, means then you can go with Ichabhedi. If you want a Mrudu Virechana without harming the patient, so Aram se we can give Virechana, so then we should go with Trivrit. Sukha Virechana. Okay, so then patient is very mild and Mrudu Kosta, very Mrudu Kosta. So then we can go with Aragvada Paramajja. Aragvada Palamajja. So Aragvada Palamajja. So then we can go with, it's Mrudu and Sukumara patients. We can go with some Greha Yoga also along with Aragvada Palamajja. Okay. So in the market we are available is either we should go with Erenda or Trivrut or Ichabhedi. Classical Virechana, we cannot go with Ichabhedi, we should go with Abhayadimodaka or else with Trivrut Laikya. And if you don't want complication, means better go with Trivrut Laikya. So even if you give Erenda, Gandharvas Erenda Taila, proper dose should be calculated. So and then expecting Virechana after some 3 to 4 hours of administration of the medicines. Usually, the castor oil act as a purgative when it reaches a large intestine. Till then, it won't act as a purgative. It's Srota Shodhaka till then. Okay. So in that case, the time will be lagging. Some 3 hours, 4 hours, 5 hours it will take to start its action. If we give this one, Trivut Lekha within 1 hour to 45 minutes to 1.5 hours, it will start its action. In Ichabedi also, after 1 hour, it will start its action. Okay. So if you want to give this one, yadu Gandharvasadi aritaki, boil it with Gandharvasadi ಏನಂತಲ್ಲ, boil it with water and do some samskara. So with hot water anupana or hot milk anupana only if you advise, then it will start its action little bit early. 3 hours effect ಮಾಡೋದು we can expect by 2 hours. 2.5 hours we can expect with age. Okay. Next, Chitraka Devati. ಚಕ್ರದತ್ತದಲ್ಲಿ ಅಧಿಕಾರ is Grahani. Even Charaka also we have a Chitraka Devati in Grahani. Chitraka Devati Grahani Adhikara. Kshara, Lavana, Panchakola. Kshara, Lavana and Panchakola. Kshara, Lavana and Panchakola. Bhavana Dravya is Dadimadi Swarasa. So for Chitraka Devati, you can advise Anupana also, Dadimadi Swarasa or Matunanga Swarasa Anupana also you can advise. Here in Chitraka Devati, Bhavana Dravya is Dadimadi Swarasa. In some other books, they are given Bhavana Dravya is Matlanga Swarasa also. Okay. Indications Amavata, Agnimandya. Amavata and Agnimandya. If Chitragadivati is prepared out of Dadimadi Swarasa, then we can use Chitragadivati for longer period. No side effects will come. So longer period means 15 days, 1 month, 2 months, 3 months. So more than 3 months, very cautiously use because it contains a Kshara and Lavana. So Kshara and Lavana should not be used for a longer period. Kshara, Lavana and people. So we learned it from Subhashi Sahitya, first year BMS Samskrita. Kshara, Lavana people should not be used for longer people. So at the same time, Chitragadivati, 80% of Chitragadivati is Kshara and Lavana. So you should use Chitragadivati very cautiously for longer period. For shorter period, action can be expected. So it's a very good Amapachaka. Amma present in Sarvadata also we can have a good result with Chitragadivati. Very good Amapachaka because it contains a Kshara. Only Lavana or Matalunga or Dadima, so we can restrict the action only in Amasya. Okay. So, but it has a Kshara. Kshara will have a deeper penetration in deeper dhatus. Okay. Sarvadhatu Amapachaka action can be expected in Chitragadivati. So, in my clinical practice, I will use Chitragadivati more than a kg in a month. So, it means 4,000 tablets in a month. So, very good drug of choice. So, in many patients, in case of Amla Pitta, in case of Agnimandya, in case of thyroid, some patients complain about indigestion and other things. So, in case of diabetes, in Panchakarma, Dipanapachana cases, many instances, even in Amavata, many instances we will use Chitragadivati. So, single drug, we can expect Dipanapachana action. Okay. Very good drug of choice. So, while using Chitragadivati, before administration to the patient, just try out Chitragadivati yourself because Baidyanath Chitragadivati is very strong. We cannot advise Baidyanath Chitragadivati more than 7 days. So I am using Kashmir Company Chitragadivati. It's very mild. Even after consumption of 10 Chitragadivati also, I won't get a loose motion. But Baidyanath medicine, if we give 2 tablets of Chitragadivati, Baidyanath medicine, patient will get loose motion. It has highest Kshara and Lavana. And purification and Bhavana Dravya also depends. What is the Bhavana Dravya used? We don't know. So, Baidyanath Company. So like that, before administration of Chitragadivati, you should use yourself and measure the Tikshna and Ushnatva of these medicines. Then you can advise it to the patient. So otherwise, Ayurveda medicine will have a special side effects. We cannot tell side effect, it has a special effects. Next, Narikela Lavana, Shuladikara. It has only 2 ingredients. So coconut and as well as Sign development. So dose is 1 to 2 grams. Anupana is Pippali Churana or Kanji. Anupana is Pippali Churana and Kanji. Indications in Shula, all types of Shula. Especially in case of Vaishya Ratnavali and Yoga Ratnakara, Narikela Lavana is indicated in polycystitis, Udara Shula especially. Polycystitis cases. And a lot of clinical trials also done in Narikela, action of Narikela Lavana in case of polycystitis. Gallbladder obstruction, gallbladder stools, gallbladder inflammation. Okay. So usually when patient come to your clinic with cholecystitis or bigger gallstones, we'll refer to the modern surgeon. We cannot treat, but you can have a try with Narikel Lavana with Kanji Anupa. Kanji. If Kanji is not available, then advise Takka. Some sour taste must be given along with Narikel Lavana. We have very good results with this Narikel Lavana and Kanji as a medicine in case of polycystitis. And sometimes stones came out. Sometimes it will correct the green liver. So the stone formation will be reduced. Okay, stones may come out sometimes. So in my clinical practice, I will use Pudina along with this Narikela Lavana, this one. So 3 grams, 3 to 5 grams of Narikela Lavana along with tender coconut water. In some patients, it will have a Pitta Pradhana Samprapti. And this one, Kanji and Pudina. So Pudina Kashaya or Pudina fruits we can prepare and we can advise along with Narikela Lavana. In one folklore practice, we used to keep Narikela Lavana overnight in tender coconut water. We'll just open the cap of tender coconut water and we'll keep 10 grams of Narikela Lavana overnight. So ask the patient to drink Narikela Lavana along with tender coconut water early in the morning. So best drug starts. So you should continue for 21 days to 48 days. You will tell within 7 days it will go. Whatever with the store in the liver. So this is a folklore practice. Okay, just try. Our operation ಮಾಡ್ಕೊಳ್ಳಿಕ್ಕೆ they will spend like 60,000 to 1 lakh. So once gallbladder is operated, every organ has some importance in the body. Gallbladder is meant for storage of bile juice. If bile juice is not stored, means they will develop indigestion. When they consume any fat food and fat material, emulsification of fat should be done by bile juice. Then fat digestion will be delayed. You should wait for the bile juice to release from the liver. Okay. So then the problem starts with indigestion, acidity, so flatulence, so weight loss, everything will start after removal of gallbladder. And we have observed after removal of gallbladder, patient will develop type 2 diabetes mellitus, insulin resistance. It is connected with polycystic. So in this case, better to keep any organ in the body. If it is unwanted, also even appendix. We don't know what is the action of appendix. Still, we should keep appendix in our body. So if surgeon opens abdomen for any reason, he will remove appendix. Any laparotomy, he will remove appendix without fail. It may be for anything, he will remove appendix. So we will tell in future if you get appendicitis, we will operate it earlier. Not okay. Next formulation is Sutashekara. Sorry, Lagu Sutashekara. So Narikela Lavana, you should keep in your mind. So this the medicine can be used in case of Udara, especially in case of polycystitis. Along with Anupana is most important. So and why I am stressing about Anupana is this only bring the medicine towards our target. This is a rocket launcher or a drug launcher. Just like a rocket needs a launcher, so our medicines needs a drug launcher. These Anupanas will bring this drug to the particular target. Okay, action. Right. So next is Lagu Sutashekara, Gairika Shunti, Nagavalli Swarasa Bhavana. Gairika, Shunti, Bhavana with Nagavalli Swarasa. It's a good Pittahara Dravya. So Pittahara Tvak Vikaras, we can use this Lagustu Shekara. Pittajanya Tvak Vikara. Pitta Pradana Tvak Vikara. Okay. Better action. And mild to moderate Ama Pradana conditions. Amajat Vikara also we can use Lagustu Shekara. Next, Chandra Prabhavati. So you know about Chanda Prabhavati and you have seen Chanda Prabhavati prescription from your seniors or from your teachers in many of the female fertility or menstrual disorders. Here Chanda Prabha means the drug Shetty. Shetty is the synonym of Chandra Prabha. So Adhikara of Chandra Prabha, if you go with the classical Yoga Ratnagara or this one, what it is there, Prameha Adhikara. But in clinical practice, it will correct the Agni in Garbhashaya. Garbhashaya Shodhaka action also can be expected, and it will correct the Agni in Garbhashaya. The same drug will maintain the hormonal balance in female, and it will correct Vata, Apana Vata, and it has a rasana, it contains Shilajita. Chandraprabhavati contains Shilajita. And then it can be action can be expected in Mutrava Sotorukaras also. It's a rasayana. If a drug contains a key ingredient as a rasayana, the drug can be considered as a rasayana. The probability is Agni Mandya, it will correct Agni Mandya in the Garbhashaya, it will balance the hormones and act as a rasayana. So Mutra Shodhaka action also expected. And also it contains a Trivrut, one of the key ingredients. If consume 2 to 3 Chandapravati, they will have a easy motions, easy defecation. Okay, single drug, multiple action. Okay. Shadbindu Taila. Next formulation is Shadbindu Taila. Chakravarta reference. Shiro Roga Adhikara. Shiro Roga Adhikara. Main ingredients. Like key ingredient as a Bhavana Dravya, sorry, Drava in case of Shadbindu Taila is Brungaraja. Okay. This Shadbindu Taila can be used in case of sinusitis, Nasa Harsha conditions. So as a Nasya Dravya. Even neurological defects want to rejuvenate nerve cells. So Urdu Jatrudagata Roga, we can use Shadbindu Taila. And it's a rasayana. Brungaraja is a rasayana actually. So Brungaraja Swarasa is used in the preparation of Shadbindu Taila. So this medicine also acts as a rasayana rather than Shodhana. The comparison with Anu Taila and Shadbindu Taila, Anu Taila is a Shodhaka Dravya. Shadbindu Taila acts as a rasayana. Rejuvenation action can be expected with Shadbindu Taila. We'll go with some Swarasas. Tulasi Swarasa is the first one. Vishama Jwara. Tulasi Swarasa. Vishama Jwara. Kasa Shwasa Jwara. So in olden day practice, you have a mild to moderate cough and running nose, fever. They will give you 1 or 2 leaves set of tulasi. It means 6 to 8 leaves of tulasi, and 1 piece of garlic, 1 pinch of pepper, and some jaggery. Ask the patient to chew, and then he can consume whole 3 to 5 times a day. So then the fever will go within a 1 or 2 days. This is the folklore practice or homemade medicines used in olden days. So tulasi, garlic, pepper, and as well as jaggery. So thing is they have to chew. So tulasi is a best kafara dravya, and as well as at the same time it will increase the pitta also. So while advising in the patients of pitta, you should be careful. So it's definitely will get a very good effect on kapha. So then don't advise tulasi every day. They consume some 3 to 4 leaves of tulasi every day. That will aggravate pitta. Especially it will stop coagulation. So blood coagulation agilla andre bleeding will continuous. Pitta will increase by consuming tulasi. According to some research, the Krishna tulasi contains a part of some amount of mercury. Minimum amount of mercury, 0.0001% of mercury is present in Krishna tulasi. Such a potent drug, tulasi. So it should not be any drug should not be consumed regularly. My advice is whatever it may. So in folklore practice, they will advise in TVs and radios. They are not doctors, so they don't have degree certificates and all. They will give you free advices. So consume tulasi regularly, consume guduchi regularly, consume neem regularly. So any drug, I will advise. The body has an immunity; it will correct whatever may be the things in our. If body will not work, then only we can go with the medicines. Okay, so just to improve the immunity and other things, they will advise to consume. Body know how to maintain its immunity, not with the medicines. So post COVID, every company will bring single herbal medicines. Guduchi, Nimba, Bhumi Amalaki, Tripala, every company has made a single herbal medicine. They will advise to consume single herbal medicine for longer durations every day. So it's not good. So then if you advise medicines to the body, then the medicines won't work. They consume medicines regularly. Medicines become satya. If you consume tulsi regularly, if you need it during cough, if you advise tulsi, it won't work. Tulsi becomes satya, aroka satya. So that's why whatever may be the drug, so don't advise regularly. Okay. So tulsi is a very potent drug which can be used in case of mild to moderate fever. Antimicrobial property can be expected from tulsi. Good kafara dravya. Okay. So the enhanced action of tulsi, we are using garlic and pepper along with guda. Okay. So very good drug of choice. Even in case of mild kasa, shwasa, jwara, definitely the single herb we can cure the disease. Tulasi swarasa. Then ardhaka swarasa. Shota. Vaishya Ratnavali, Shota Adhikara. Key ingredient is Ardraka. Key ingredient is Ardraka. So just note down, it is advised in case of Rushana Vata. Ardhaka Swarasa indicated in case of Rushana Vata. Kasa Shwasa Ajirana. Anaha, Amavata, Shota. Kasa Shwasa Ajirana, Anaha, Amavata, and Shota. Special underline to Rushana Vata. So testicular atrophy, testicular swelling, testicular infections, that time we can use Ardhaka Swarasa. So to push and a patient having a low motility because of Kapha Pradhanatva. So Avarana, Kapha Avarana. In that case, we can use Ardhaka Swarasa. So Ardhaka Kashaya or the Shmula Arishta will give 5 ml to 10 ml Pipalya Sava in case of low motility. Don't advise IMO 15 ml 20 ml advise ಮಾಡಿ ಮತ್ತೆ irritation ಎಲ್ಲ ಸ್ಟಾರ್ಟ್ ಆಗಿ patient won't confuse. Just 5 ml of Ardhaka Swarasa. Ardhaka Asava is available in the market. So we can advise in minimum dose. So it will be good in case to improve the motility. In case of Kapha, right? ನೋಡಿ ನಿಮ್ಗೆ ಆರ್ಧಕ ಸ್ವರಸ ಶುಂಠಿ ಅಂದ ತಕ್ಷಣ ವಿಲ್ ಥಿಂಕ್ ಅಬೌಟ್ ಅಪ್ಪರ್ ರೆಸ್ಪಿರೇಟರಿ ಲೋವರ್ ರೆಸ್ಪಿರೇಟರಿ ಮ್ಯಾಕ್ಸಿಮಮ್ ವಿಲ್ ಥಿಂಕ್ ಅಬೌಟ್ ಇಂಡೈಜೆಷನ್. ಹಿಯರ್ ದ ಇಂಡಿಕೇಶನ್ ಇಸ್ ಉಷ್ಣವಾತ. ಓಕೆ, ವಾಸ ಪುಟಪಕ್ವ ಸ್ವರಸ, ವಾಸ ಪುಟಪಕ್ವ ಸ್ವರಸ, ರಕ್ತಪಿತ್ತ ಕಾಸ ಜ್ವರ ಕ್ಷಯ. ರಕ್ತಪಿತ್ತ ಕಾಸ ಜ್ವರ ಅಂಡ್ ಕ್ಷಯ. ಮಹಾನಿಂಬಕಲ್ಕ, especially you should note down Mahanimbakalka is indicated in Rudrasi Vata. Mahanimbakalka advised in Rudrasi Vata. Rudrasi. Okay. Nimbakalka ನಮಗೆ ಗೊತ್ತು, ರಣ, ಪಿತ್ತ, ಕಫ, ಕ್ರಿಮಿ, ಋಣಾರೋಪಣ and other actions. Mahanimba is especially indicated in Rudrasi Vata. ನೀವು ನಿಂಬಾನು ಋಣ ಇರುತ್ತೆ, ಮಹಾನಿಂಬ ಕೂಡ ಋಣದಲ್ಲಿ ಇರುತ್ತೆ ಅಂತ you will write down. So Mahanimbakalka is specially indicated in Rudrasi Vata. Mahanimbakalka, Rudrasi Vata. ತಂಡುಲಿಯ ಕಲ್ಕ, ರಕ್ತ ಪ್ರದರ. ತಂಡುಲಿಯ ಕಲ್ಕ, ರಕ್ತ ಪ್ರದರ. ನೆಕ್ಸ್ಟ್ ತಂಡುಲಿಯ ಕಲ್ಕ, ರಕ್ತ ಪ್ರದರ. ನೆಕ್ಸ್ಟ್ ಇಂಗ್ವಾಷ್ಟಕ ಚೂರ್ಣ. ಇಂಗ್ವಾಷ್ಟಕ ಚೂರ್ಣ, ಅಗ್ನಿಮಾಂದ್ಯ. Key ingredients: Trikatu, Ingu, Ajamoda, Jeeraka, Saindava. 1 karsha each. Trikatu, Ingu, Ajamoda. Trikatu, Ingu, Ajamoda, Jeeraka, Saindava. Can be used with Guta, Takra and Ushnajala as an Anapana. Prathama Kavala Bhakta, if you underline, it should be taken along with first bolus of the food. Prathama Kavala Bhakta. Indications: Deepana, Pachana, Vadana, Lomana, Shulakta. Deepana, Pachana, Vadana, Lomana, Shulakta. Deepana, Pachana, Vatana, Lomana, Shulakta. Here the Shula refers to the colicky pain in the abdomen, especially in case of menstrual colic also we can use Ingvastika Shula. Okay, so it is the best Vatanalomaka Dravya. So we are used in case of renal colic, so renal calculi and abdominal pain, so indigestion and abdominal pain, so menstrual cycle with abdominal pain, dysmenorrhea, it's called as dysmenorrhea. In all these cases, any sort of abdominal pain below epigastrium, we can rely on Ingvastika Shula. So we can use Takra as Anupana as a better protraction, or else Gruta as Anupana directly. Okay, so some patients I would advise only Hingu, Buddha, and hot water. In case of only Hingu, Buddha, and hot water. In case of abdominal colic, because they are very far away from us and they don't have any other medical specialties and other drugs. So, what are the kitchen medicine can be advised in case of severe colic pain? You can use Hingu. Okay, Hingu is the best painkiller in especially in colic pain. Okay, so just 2 pinches of Hingu, 1 cup of hot water. Okay, and 1 teaspoon of Buddha. So within half an hour, pain will reduce. 30 to 45 minutes. We cannot expect the same action with meftal or tromodolol or cyclopam or cyclamef, all these medicines. I can bet. Okay. So such a wonderful result we'll get it from Invast Kachoda. Only with Ingu we'll get the result. Ingu is a adulterated drug. So we have highest adulteration with Ingu. So 1 kg of Ingu is mixed with 10 kgs of maida powder or cutlet powder. So other powders, they will adulterate and then only they will sell. Just check out the label. What is the quantity of Ingu? Very clearly they are mentioned. Ingu aspartate 10%, 90%, some other powder. Then you can think that what is the potency of pure Ingu. 1 kg of Ingu costing about some 4,000 to 5,000 pure Ingu. If you keep Ingu here, you will get smell at least for 100 fits. Original Ingu. Very good one. Very good potency also. ಒಂದ್ಸಲ ತೆಗೆದು ನೋಡಿ ಇಂಗು ಬಾಟಲ್ ಸಿಕ್ಕಿದ್ರೆ ಮನೇಲಿ ಹೋಗಿ ಏನಿದೆ ಇಂಗು ಬಾಟಲ್ ಅಲ್ಲಿ ಸೀತಾಫಲ ಚೂರ್ಣ ಶರಂಗಧರ ಚರಕ ಸಮೇತ ಆಲ್ಸೋ ಇಟ್ ದೇರ್ ಇನ್ ರಾಜಯಕ್ಷ್ಮ here Sitafala means in first year BMS usually with cough and cold we went to the pharmacy, they are given Sitafala churna. So after consumption of Sitafala churna we thought it is made up of Sitafala fruit. Here Sita means not Sitafala fruit, Sita means Sharkar. And that sensation is also like that only. It contains people, the tingling sensation will be there in the tongue. We thought it is made up of Sitafala fruit only. Oh, fruits ಎಲ್ಲ ಮಾಡ್ತಾ ಇದಾರೆ ಇಲ್ಲಿ ಅಂತ ಖುಷಿಯಾಗಿತ್ತು ಆಗ. Here Sita means Sharkar, 16 part of Sharkara. Then Vamshalochana, half of the Sita is Vamshalochana, 8 part. Then Pipali 4 part. Ela 2 part. Tvak 1 part. Sita 16 part, Vamshalochana 8 part, Pipali 4 part, Ela 2 part, Tvak 1 part. So here the question they will ask you is what is the percentage of each drugs? So you should remember the each ingredient SV PET, Sita, Vamshalochana SV, P is Pipali, E is Ela, T is Tvak. SV PET, short form. SV PET, 16 part, 8 part, 4 to 1. Okay. So Vamshalochana is also called as Tugakshiri. Tugakshiri. One more name for Vamshalochana it is Tugakshiri. Vamshalochana is a Shrestha Kafara Dravya. Vamshalochana is best Kafara Dravya. Kafara action can be expected with Vamshalochana. Sita is Pittahara. Here, Sitaphala Churna can be used in case of Pitta Kafaja, Kasa, Pitta predominant Kapha Vyadis, or Kapha Pitta Vyadis. We can use Sitaphala Churna. Indications: Daha Shamaka, Daha Shamaka. Pitaphala directly we can use in Daha conditions. Daha Shamaka. Pachaka, Deepaka, Deepaka and Pachaka. Deepaka, Deepana and Pachana. Kasa, Swasa, Kshaya. Kasa, Swasa, Kshaya. Padadah. Here, special note down is Padadah. Sitaphala Churnaku, Padadahakuno, Elindali relation. There is a huge indications here. Sitaphala Churna, we can expect the result only in upper respirator, lower respiratory. Immediate Kasa, Swasa, and Kshaya. And the Adhikara in Charaka Samhita, Kasa Pradhana Rajakshmagali, they are indicating Sitaphala Churna. Kasa Pradhana Rajakshma. Okay, Sitaphala Churna, they are explained. But here the action is Padadah. Pitta Pradhana Vyadis, we can use Sitaphala Churna. Any burning sensation in Asta and Pada, we can use Sitaphala Churna. Supta Jiva. So patient will tell you about there is no taste sensation. Let them take Sitaphala Churna directly. They will get sensation. Okay, it is the Pachana Dipana also. Supta Jiva. The direct indication they are given. Supta Jiva. Yen Tindru taste Sitila doctor and Tamandra. Otherwise, Sitaphala Churna for 5 days. Then they will get taste. Okay. Udavarta Raktapitta. Udavarta and Raktapitta. So, when we are going for a practice, we will forget everything. During second year BMS, for the purpose of exam, at least we will read. So, third year we will forget. Fourth year we will forget. Fourth year we will remember Sitaphala Churna. But indications, Rupana, their Palashruti and other things, their Adhikara, no, we forget. Actually, for clinical practice, we need to study Vaishya Kalpana, Rashastra, Dvavyaguna. So nowadays, patient will come with a diagnosis. They will be self-diagnosed many times, and many times they will go to allopathy doctor and they will do all the necessary investigations. Finally, they will diagnose and they will come to Ayurveda Vaidya. Many patients come in chronic conditions only. At that time, no need of diagnosis. Roganidana level will be restricted over there. So already patient is diagnosed. Stage is fixed. Then we need to write the prescription. When you have to write the prescription and Patya, the role of Rashastra, Vaishya Kalpana, Dravyaguda, and Swastarutta is very good, very high. Okay. So you have to put maximum effort in memorizing the dravyas and their indications, all the formulations, their utility. At least some 50 formulations, it will be there in your tongue of the tip of the tongue. Okay. So when patient come to clinic, immediately you should write. So Supta Jivata Padada, along with some Kasa, Sitaphala Churna fix. Okay, Padada has Sitaphala Churna fix. So Shula, Ingvashtaka Churna. Fix it with the level. So Namaga easy we can practice. Okay. Next. Talisa the Churna. Talisapatra 1 Karsha, Maricha 2, Talisapatra 1 Karsha, Maricha 2 parts, Shunti 3 part, Pippali 4 part, Vamsharochana 5 part, Yela and Tvak half Karsha. Yela and Tvak half Karsha. Usually patients, so especially come public, they will come and ask about Talisapatra Adi Churna. We'll show Talisadi Churna. So they will tell this is not Talisapatra and they will go back. All medicines are same. Talisadi Churna, Talisapatra Churna is same. But in TV, they told about Talisapatra Churna. And again, patient will come, they will ask, Jeshtamadu Churna. We will show Eshtimadu Churna. They will reject. No, this is not Jeshtam, this is Eshtimadu. Okay, they don't know signings also. Even the persons will come in TV, they will read some books and Kannada books and all. Before going to TV, they will read some Kannada books and all, they will go. So those who are practiced, they won't go to the TVs, and those who are coming in the TV, they were not. They were not in practice. So there is the large gap between a practitioner and a speaker. Even in colleges also, those who will teach, they won't practice. Those who are practice, they won't teach. In many institutions, 90% of the teachers, they won't practice Ayurveda, but they will be teachers of Ayurveda. And in 90% of the practitioners, they won't teach, they will restrict it to the practice. I'm also one of the examples for that. I will practice, and at the same time, I'm in the college, but I won't teach. But I'm teaching in my own platform. At least I'm doing this. I'm making the student to a good practitioner. Okay. So ಶರ್ಕರ ಕೆಲವೊಂದ್ಸಲಿ ಇರುತ್ತೆ, ಕೆಲವೊಂದ್ಸಲ ಇಲ್ಲ ತರಕಾರಿ ಶುಕ್ನದಲ್ಲಿ. Some companies they will add ಶರ್ಕರ. ಶರ್ಕರ is equal quantity of all the ingredients, 32 parts. ಎಲ್ಲ ingredients ಸೇರಿದ್ರೆ ಎಷ್ಟು ಪಾರ್ಟ್ ಆಗುತ್ತೋ ಅಷ್ಟು ಪಾರ್ಟ್ ಶರ್ಕರ is already ತಾಲಿಸಾರಿ ಚೂರ್ಣ. So indications: ಅರುಚಿ, ಕಾಸ, ಆತ್ಮಾನ, ಗ್ರಹಣಿ, ಪಾಂಡೆ. ಅರುಚಿ, ಆತ್ಮಾನ, ಪ್ಲೀಹ, ಗ್ರಹಣಿ, ಪಾಂಡೆ. So you just think about Vamana action while reading pharmacodynamics and pharmacokinetics, a modern text. While reading about antacids and H2 blockers, proton pump inhibitors drugs, especially proton pump inhibitor is pantoprazole, for example, rabiprazole, esomeprazole. So while reading all the drugs, they are given the pH of stomach is directly proportional to the pH of lungs. If the kapha increase in the stomach, vice versa, the kapha in lungs also increases. If kapha increase in the lungs also, vice versa, the kapha will increase in the stomach. The pH of lungs and as well as stomach is directly proportional. That's why after Vamana, patient will be all right. If the asthma patient, you give some Sadhya Vamana, patient will be all right. So we are given medicine for the stomach, and all the content of the stomach is coming out through the vomitus. We are not all treated the lungs here, but patient will reduce his kapha in the lungs. Patient will be all right symptomatically. How? This is the thing happen. Correct alva? Vamana ಮಾಡಿದಾಗ ಏನು ಮಾಡ್ತೀವಿ ನಾವು? We will give medicines to the stomach. The stomach content will coming out. At the side by side, the lung will cleanses. Lunging ನಾವು ಏನು ಮಾಡೇ ಇಲ್ಲ ಇಲ್ಲಿ. How kapha will come out from the lungs? This is the logic. At the same time, here Talisadi Churna, you see how they are given indications. So it will take out the kapha from Amashaya and Pakvashaya, and at the same time, it will reduce the kapha from lungs. Got it? Just check the indications. Haruchi along with Kasa, Kasa Pradhana Haruchi, and it will do Pachana, and then it will work in Admana, Liharoga, Grahani, and Pandu. Okay. So Talisadi Churna action not only expecting in Uras Pradesha, not only expecting with upper and lower respiratory infections. So it has a very good option with Ekrut Bikaroga and Amashya and Pakvashya. So best Kafara Dravya, Kafara Churna, Kafara action we are expecting. So we can advise Talisadi Churna. Pitara action, Sitaphala Churna. Rasayana action, Sitaphala Churna. Deepana Pachana, Anulomana action, Talisadi Churna. So in case of dry cough, Sitafala Churna, in case of wet cough, Talisadi Churna. Pitta Pradana, Sitafala Churna, Kapha Pradana, Talisadi Churna. So many times this is the confusion we have whether I should prescribe Sitafala Churna or Talisadi Churna or both. Some physicians they will prescribe both. Why do worry? Let body will take, body will function itself. We will give both Sitafala Churna and Talisadi Churna mixed. 10 grams of Sitafala, 10 grams of Talisadi mixed and advice to the patient. If Pitara is like Kafara, let body can adjust itself. So as a physicians, you must have the clarity about your drug and prescription after seeing the key ingredients and after checking with the indications. Okay. So Pitta Pradana Kapha Sitafala. Kapha Pradana Pitta Talisadi. Okay. So this is the way we should learn Vaishya Kalpana for clinical practice. Next, Lavana Bhaskara Churna. Agni Mandhyadhikara. Lavana Trikatu. Pipali Churna. Trimada. Dadi Matvak. Talisapatra. In Lavana Bhaskara Churna, key ingredient is Samudra Lavana. Four Lavanas are present in Lavana Bhaskara Churna. Main Lavana is Samudra Lavana. Highest amount of Lavana Bhaskara Churna is Samudra Lavana. Sea salt, what we are using. So indications Deepana, Pachana, Vata, Vilomana. Pleha, Amavata, Rudroga, Mandagni. Deepana, Pachana, Vata, Lomana. So you just check with the action of Lavana Rasa. Anywhere. Even Ashtanga Rasangraha, Ashtanga Hridaya, Charaka Samhita. So wherever the Lavana comes, so it has a Vatana Lomana action, Stambahara action, Kapha Vilayana action. Okay, wherever the Lavana comes. Okay. So Lavana is the best Vatara Dravya we can expect. So here Lavana Bhaskara Churna, here also in the indication very clearly that means Vata and Anulomaka. So Ingvashtaka Churna will not, Vata Anulomana will do, but it is not a defecator. It cannot be used as a laxative or a defecation. If patient come with colic pain and constipation, then it will advise Lavana Bhaskara. Patient have only colic pain, Ingvashtaka. Got it? So that is the difference. It can be used in case of Bagandhara, Amvata, Rudroga, Mandagni. So constipation only in Purisha Kshaya Lakshana just go with it. Purisha Kshaya Lakshana. Rudroga either. Cough muscle pain and as well as Rudroga. Purisha Kshaya. Here Lavana Bhaskara Churna is indicated Rudroga and Mandagni. Any spasm, muscular spasm will go by consuming a Lavana. Sodium and potassium. Okay, that will remove the spasm from the body. Vata. Vata stambhana irata. So it will remove the stambha on the body. Lavana. So calcium channel, sodium channel, it will be open. Okay, circulation will happen properly. So polarization and repolarization. You have studied about the cardiac conduction system. First year DMS anatomy. So there calcium and potassium action. So calcium and sodium action. So polarization, repolarization. So there we can expect good action from these medicine. Okay. So Rudroga and Takshana now ischemic heart disease kodavada athwa cardiac block cell kodavada? No. So the Rudraga action expecting from Lavana Bhaskara Chota is it will do Vata Lomana. So the Rudraga because of constipation, because of Purishakshaya, because of Hatman. So we can use Lavana Bhaskara Chota. ರುದ್ರೋಗ ಅಂದ ತಕ್ಷಣ ನಾವು ಕೊಡೋಣ ಬಿಡು ಲವಣವಾಸ್ಕರ ಇಂಡಿಕೇಶನ್ ಕೊಟ್ಟಿದಾರಲ್ಲ ಕಾರ್ಡಿಯಾಕ್ ಬ್ಲಾಕ್ ಅಲ್ಲಿ ಕೊಡೋಣ ಇಸ್ಮಿಕ್ ಕಾರ್ಡಿಸ್ ಅಲ್ಲಿ ಕೊಡೋಣ ಕೊಡ್ಬೋದು ಫಾರ್ ಎ ವಾತಾವರಣ there is no direct action of lavana bhaskara on heart. It has action on so yavadu srotas. Indirectly it will work on rudroga. Okay. ಮಹಾರಾಷ್ಟ್ರಾದಿಕ್ ವಾತ ಸರ್ವ ವಾತ ರೋಗ ರಾಸ್ನ ಬಲ ಏರಂಡ ದೇವದಾರು ಧನ್ವಯಾಸ ಗುಡುಚಿ ಶತಾವರಿ so all best vatara dravyas meet in Maharashtra Vata. Here you can just check it out. Devadaru is Tudoshara, Erandamula is Rushya Vatahara, Bala is Shrestha Vatahara Dravya. So Rasna is especially a good drug for Vata. So the key ingredients are Rasna, Bala, Eranda, Devadaru, Dhanvayasa, Guduchi, Shatavari, Kantakari, Pippali. Okay. Key ingredient is Rasna. So indication is Sarva Vata Roga and as well as it acts as a Rasayana. I told you in last class. So Rasnadi Kashaya and Maharasnadi Kashaya. Maharasnadi Kashaya at times some Rasayanas. Okay. So Rasnadi acute, Maharasnadi chronic. Sarvanga Kampa, Ujjata, Amavata, ಅಪತಾನಕ ನೋಡಿ ನಿಮ್ಗೆ ಮಹಾರಾಷ್ಟ್ರ ಇದು ಶಾರಂಗಧರದಲ್ಲಿ ಸ್ಪೆಷಲ್ ಇಂಡಿಕೇಶನ್ ಫಸ್ಟ್ ಗಿವರ್ಸ್ ಓಕೆ ಗರ್ಭಾಶಯ ರೋಗ ಬಿಕಾಸ್ ಆಫ್ ವಾತ ಇಂಡಿಕೇಶನ್ಸ್ ಗರ್ಭಧಾರಣ ಸೊ ಮಹಾರಾಷ್ಟ್ರದಿ Vata can be used in case of infertility, especially in case of female infertility because of Vata dosha. So Garbhadharana function. Shukra Roga also it will helpful. Vataja Shukra Roga. Okay. So these two are special indications of Maharasnadi Kashaya. Mikidella Vata Gotakbadatan. So especially the same medicine can be utilized in case of Garbhashagata Roga because of Vata. Shukrashagata Roga because of Vata. Okay. And infertility gunu Maharasnadine. ಅಥವಾ ಬಾಡಿ ಪೇನ್ಸ್ ಇದ್ರು ಅಮ್ಮವಾತ ಇದ್ರು ಮಹಾರಾಷ್ಟ್ರ ಸಯಾಟಿಗಾಗೂ ಮಹಾರಾಷ್ಟ್ರ ಅಮ್ಮವಾತಕ್ಕೂ ಮಹಾರಾಷ್ಟ್ರ ಸಂಧಿವಾತಕ್ಕೂ ಮಹಾರಾಷ್ಟ್ರ ಸೊ ಸೇಮ್ ಡ್ರಗ್ ಮಲ್ಟಿಪಲ್ ಆಕ್ಷನ್ ಸೊ ವೆರೆವರ್ ದ ವಾತ and we are expecting a rasayana action in case of chronic. Usually acute amavata is kapha pradhana, so chronic amavata is vata pradhana. So ruddha amavata is equal to ಸಂಧಿವಾತ ಆಮ ಇರಲ್ಲ ಎಲ್ಲ ಡ್ಯಾಮೇಜ್ ಆಗಿ ಉಳಿದಿರೋದು ಜಾಯಿಂಟ್ ಅಷ್ಟೇ ಈಕ್ವಲ್ ಟು ದಟ್ ಆಫ್ ಸಂಧಿವಾತ ಓಲ್ಡ್ ಕ್ರಾನಿಕ್ ಆಮವಾತ ಕ್ರಾನಿಕ್ ರುಮಟೈಡ್ ಈಸ್ ಈಕ್ವಲ್ ಟು ಆಸ್ಟಿಯೋ ಆರ್ಥ್ರೈಟಿಸ್ chronic rheumatoid arthritis is equal to osteoarthritis. There the drug of choice will be like that of osteoarthritis. Okay. So in children, we can advise 1 gram to 5 grams of Sitafilajona. Here the question they ask. 1 grams to 5 grams. So in classically, the dose of Churna, they are advising about 12 grams. 1 tula, 12 grams, 10 to 8 to 12 grams. So nowadays, with Agni Bala and Parabala, we can give 1 to 5 grams in case of children below 5 years of age. After, we can calculate according to their body weight, we can give the Sitafilajona up to 12 grams in a day. Next is Shadanga Paniya. Musta Chandana Parpata Uditya Ushira Nagara. Jala is 64 part 1 is to 64 is the formula for Shadangapaniya. So 30 to 61 with Sita. First action of Shadangapani is Daha Shamaka. Next action is Jwara Trishna Daha. ಖರ್ಜೂರಾದಿ ಮಂತ ಮದತೆ ಇದೊಂದು ಸುಮಾರು ಸಲ ಕೇಳಿದ್ದಾರೆ ಖರ್ಜೂರಾದಿ ಮಂತ ಇಂಗ್ರೀಡಿಯೆಂಟ್ಸ್ ಖರ್ಜೂರ ದಾಡಿಮ ದ್ರಾಕ್ಷ etc. So how many days we can advise ಖರ್ಜೂರಾದಿ ಮಂತ ಸದ್ಯೋ ಬಲಕರ. Okay, can we continue it for 7 days? ಖರ್ಜೂರಾದಿ ಮಂತ can we advise this for 7 days? Next Panchakola ದಿ ಫಾಂಟ ಯಾವ್ದು ಪಂಚಕೋಲ ಖರ್ಜೂರಾದಿ ಮದತೆ ಸದ್ಯೋ ಬಲಕರ ತುಷ್ಟಿ ಪುಷ್ಟಿ ಬಲಕರ ನಾವು ಕೂಡ ಯೂಸ್ ಮಾಡೋ ಮದತೆ ಅಂತ ಏನಲ್ಲ. ಸೊ ಇನ್ ಕೇಸ್ ಆಫ್ ದಾಹ ಮದ ಮಧ್ಯ ದಾಹ ಯು ಕ್ಯಾನ್ ಯೂಸ್ ಖರ್ಜೂರಾದಿ. ಪಂಚಕೋಲ ಫಾಂಟ ದೀಪನ ಪಾಚನ ಅತಿಸಾರ ಅಂಡ್ ಅಗ್ನಿಮಾನ್ಯ ಪಂಚಕೋಲ. So Panchakola can be used in case of Dhatu Pachana action. If we have a Dhatugata Hama, in that conditions we can use Panchakola as a drug of choice. Especially when we planning to treat a diabetes mellitus patient having a highest insulin resistance in case of Mr. X syndrome, especially high BMI, overweight, obesity, high cholesterol conditions. So Panchakola is a drug of choice. Okay. So Deepana, Pachana, Atisara, and Agnimandya. So Agnimandya here you should consider as Dhatva Agnimandya. Still we have a content for another 1 day. So cannot complete all these things in a day. Continue tomorrow. So we'll finish 1 hour about this and we'll solve question paper. We'll discuss question paper. Already I've solved the question paper, I think. So tomorrow we'll just discuss the question paper. Okay. So these preparations, you should make a list of the preparations and read every day. In a single day, we cannot learn the clinical practice. Clinical practice, what we have learned from our UG studies will come by 25%. Remaining 25% of the clinical practice, it will come by experience. Remaining 25%, it will come by patient experience. After giving the medicines, patient will tell you about their feedback. Remaining 25%, you should learn from the seniors, our gurus, our practitioners. So total 100%, how it will come? 25% from your studies, PG studies. Remaining 25% by your own clinical experience. Remaining 25%, patient will feed their clinical experience. Remaining 25% will come from their seniors' wordings. Okay. So first 50%, 25% from studies and 25% from gurus. 50% you start in your mind and then you start practicing. Remaining 50% will come. So the practice, the clinical practice is practice for your lifetime, not a single day. So that's why it's practice only. You will not become a perfect anywhere. So till the last breath, we are practicing medicine. Okay, some ideas, some new thoughts, some new clinical vision will be coming from the patient. That's why Acharya Charaka told. So the wise person will treat everywhere, everything is a teacher. So even a patient is a teacher, paricharaka is a teacher, student is a teacher. But the unwise will find a enemy in it. The unwise person find enemy everywhere. But wise persons consider everything is a teacher. The good thing will come from any kana, we should accept. Whatever it may be. ಒಂದು ಅಕ್ಷರ ಕೂಡ ಕಲಿಸಿದಾತನ ಕೂಡ ಗುರುನೇ. ಕನ್ನಡದಲ್ಲಿ ಓಲ್ಡ್ ಅದೇ ಸಂಸ್ಕೃತದ ಒಂದಕ್ಷರಂ ಕಲಿಸಿದಾತಂ ಗುರು. Even a single information will come from anybody, should accept. First and foremost thing in clinical practice is should accept everything. It may be the failure or it may be the success. Always we should learn from failures. Whenever you go with a teacher or when you go with a seniors, first and foremost thing you should ask is about their failures. Don't ask about their success stories. First you learn about their failures. Okay, so always you should learn from failures. Failure aita disease adu matbaaru. Okay, success andre ellaru try ಮಾಡ್ತಾರೆ. Failure ಗೊತ್ತಿರಬೇಕು. Without knowing the failure, you won't be succeed anywhere. Okay, so by this we will end today's class. Tomorrow same time we will continue. Bashir Kalpana will finish at any cost. Sunday Aditya will continue. So next week at least 4 classes I will take. So within a week I need to finish Dravya. So that's the target for next week. This week Bashir Kalpana will finish. End of the next week we have a test on Dravya. Okay. Right. Any doubts?